Hi. Wow. Is this going to be okay? Well, this is exciting. What a great opportunity to be in a room with so many folks that really want to talk about fiscal matters. Isn't this fantastic? Before we get started, I'd like a sense of who is from a direct funded tribe that's in the room. And just tell me which tribe. Okay. Anybody else? Okay. All right. Paskayaki, very good. Anybody else? And who's from a tribe that has a tribal state agreement? From Kootenai Salish and okay. Okay. Anybody else? I'm okay. All right. Well, good. And then from any state agency? See? Okay. Which? Oregon. Okay. Well, what I have in mind, and I'm going to go through some of the basics of, you're going to hear all this families first kind of basic stuff probably several times today, but I'm also going to get into some of the funding opportunities for direct funded tribes as well as those with 4E agreements. We've now got about 45 minutes. We have to end by 2:20, and I'm told that I will be monitored tightly on that. So we will, and I would like to leave some time too at the end for any questions that we maybe wouldn't have covered otherwise. So I would like this to be interactive, but there's some material that I really want to get through. So if you will allow me, I'd kind of like to present. Keep your questions in mind, and then I would like to have some time at the end or as we get closer to the end, we'll probably be able to open it up more too as we see how the time is going. Is that okay? Is that all right? Well, families first. This is truly, I should tell you a little bit about myself first. I worked for the state of North Dakota for 36 and a half years, and the last 12 I was the state director of Children and Family Services. At one time or another, I was also the director of foster care and of a variety of the different child welfare programs, which has been really wonderful. When I did become the director then, I had worked at a county level and a regional level and then the state level in child welfare most all my life. For the last little over 20 years, I've been a Title IV consultant. I work with states and managing and funding child welfare systems and tribes and with universities and state training partnerships. So that's kind of my focus pretty much in Title IV or certainly in child welfare matters. Truly, the Families First legislation, I think, is the most significant since 1980 in Public Law 96-272 was passed, which changed the entire foster care system in the country within a few years. It went from pretty much a maintenance program to more of a service program, as you know, with case plan requirements and placement in the least restrictive, most appropriate placement, and a whole variety of practice kinds of things that came out of the Oregon study from the late 1970s. But I really think Families First, now shifting from being more restricted on using the open-ended entitlement money for being able to use it for preventive services, is, as time goes on, you know, the first year we're gonna move along a little bit, and then it's just gonna keep growing as we get more accustomed to what all we can charge out against the prevention money, and we have better documentation on evidence-based and promising supported and well-supported programming. It is optional. It's a regular foster care program is going to continue. So those random moment time studies that are done, well, that's all going to continue as a part of your ongoing regular foster care program. There will be some new features now that we're going to be able to have under the Families First legislation, but we are still going to have our regular 4E program, also open-ended entitlement. I'll get into in a few minutes of it. This will be some changes then on your cost allocation plan, on your adding definitions to your service, your codes. There will be a change in the child welfare, the Children's Bureau financial reporting form, the 496, because now we're going to have added features. We're going to have 2 different types of candidates for foster care. We're going to have a number of different things, which I believe will result in having to separate cost in so we can get the maximum amount of the money that's going to be allowable under Families First. There is no deadline on when you implement it, but there are some restrictions on the congregate care, and I'll get more into that in a little bit. The direct funded tribes and those tribes that have 4E agreements, I'll separate that. The direct funded tribes, well, both tribes, both direct funded and those with tribal state agreements, really need to be at the table now in the discussion, like this one, like other federal trainings, like reviewing the guidances that have come out, asking the questions of the regional office and getting clarification on things, because this is really new, and a lot of the policy is being developed as we are here. So it's going to be critical that the tribes be at the table. It's also true for tribal state agreement tribes that you participate in the planning stages and the planning team that the state has put together. Because they're going through this planning and that right now. Probably have been meeting for a few months already. It's critical that if you have a tribal state agreement, that you have representation on those task forces. Overall, work group plus the task forces that will be shaped, because your interests will be important that they be included in the state plan revision that the state is going to need to submit on how its implementation of the Families First legislation. And then, so that's having that relationship with your federal partners as well as with the state and others in your community. For example, in tribes, as you are dealing with some of your behavioral health people, what role do you want them to be playing in the delivery of services as you visualize what you really want your child welfare system to look like? Which gets me to the next point, that you never, like Don also mentioned this morning, start with money. If you do start with your planning with the money, you will be restricted in your vision. When you start with what it is you want it to do, if you were just taking a blank piece of paper, what would you want your child welfare delivery system to look like? How you need some out-of-home care, but then what types of out-of-home care? What kind of preventive services? What ongoing services? And if you have that idea and on what it is you want to do, then typically we can find a variety of funding sources. If we start with the money, again, we will be too restricted in our vision, and we will be more limited in the services that we will be providing, because there is more money available than we might even be thinking about, especially as you think beyond the federal sources and you start thinking more about private foundation money and a variety of other federal money that we typically don't think is being accessible to either state or tribal child welfare programs. So, what do you want to do? Who should do it? Of course, in the planning, it'll be as you are thinking about implementing Families First or some portions of it. What are all the requirements that come with it? And do those requirements exceed the benefit? So you want to do critical thinking on what all is available in the bill and in the funding, but what are the added requirements? Again, it is an open-ended entitlement, reimbursable for allowable prevention services to state and tribal 4E agencies or public agencies with whom the 4E agency has a 4E agreement. So those are the tribal state agreements. The focus is on keeping children out of foster care and for those needing out-of-home care that they be placed with a relative or a family or in family foster care whenever possible. And also that we look at treating the family as a whole. So we are opening up now for the first time actual services to a parent or a kin provider that we have not had before. Before, it's always been the child, and then there might be some case management kinds of things with a parent, but not treatment. So we are now talking about behavioral health kinds of treatment for a parent. All right, so provide evidence-based prevention services for up to 12 months to children at imminent risk of foster care. I will not read this. This is a quotation in the federal law on the definition of a candidate. It is very similar to what the definition is now for a candidate for foster care in the regular foster care program. And like, how many of you are from jurisdictions where you are now claiming administrative costs for kids that are candidates for foster care? Can I get a sense of a show of hands, either at the state or the tribe? I know they are at Central Council, and I know they are at Salt River. You're claiming for candidates, are you? Okay, yeah, it's in the time study. But a lot of states never did implement charging their administrative costs for candidates for foster care. But it is now, of course, that's the pathway. That's how you get in to the Families First Prevention Act services, is that candidacy. As well as parents or caregivers of the children and the children who are pregnant or parenting foster youth. The evidence-based services include, and here's the broad part, of course, mental health and substance abuse prevention and treatment services. It's going to be fascinating as you look at our mental health partners, whether it be at a tribal agency or if it be at a state agency. And we want those providers to really pay more attention to our kids that are in the child welfare system. And if their funding that they have is matchable funds, like 638 funds, or in a state agency, state general fund dollars, we want to look at, can we use some of the dollars in that other public agency to leverage it with the Families First Prevention Act money that's being managed through the child welfare system. And my belief is that we can, because we have on other kinds of things used other public money from other agencies to match with Title 4E in the state, in a child welfare system. So we want to be thinking expansively also how we can use other people's resources to help us benefit in our own tribal or state programs. And then the in-home parent skill-based programs, including parenting skills training, parent education, individual and family counseling. So this is huge. It's going to be, how does it all fit within your regular child welfare delivery system? And at some point, what kind of combination of funding can we use to be able to leverage it? And again, I want to get back to emphasizing also private money. As you look at building your program, look not only at the federal and a variety of federal monies, but also at private or individual kinds of donations, foundation kinds of monies. There are some foundations that have a particular interest in Native populations, and then there are many that have an interest in overall populations. Just about every state and many communities have foundations that award money, in so much of it can go to child welfare related agencies. The services and programs must be trauma informed, and it must be provided in accordance with promising, supported, or well-supported practices. It requires the Secretary to issue a guidance for states and tribes regarding the criteria for pre-approved list. We heard this morning that will happen sometime during the fourth quarter. may or may not happen on October 1st, but it will be in the fourth quarter. And we have an opportunity to comment on that now in the Federal Register, responding to the Federal Register. So it's essential that it not just be feedback to Jerry Milner while he's here, but also that it be in writing, because what's in writing is what they're going to be responding to. And then for tribes, these requirements, and this again, this is out of the federal law. So it means that for tribes, these requirements on the guidance for what's all included on the list has to be done in consideration of factors that are unique to the tribe. And we really want to listen and examine closely when that list comes out, and things that are not there, how do we get them there, and what will it take to get something to move from promising to supported to well supported? Because we know that the activities must be, at least 50% of the money expended must be for well supported evidence-based practice. So that means longitudinal studies. That means it has to be at least a year experience in that program. And so what might that look like? And should we be thinking now at the tribe or at a state, if it's not on the list when that comes out or when they're putting that things together, or things we believe there is no evidence-based now, what would it take to get that? And where do we start with it to get it to be supported or promising, where the timeline is not as restrictive, but we start building those research components now? What would it look like for a tribe? Would we look to a Casey family program or to another foundation or to a tribal college or to a university, School of Social Work that might have a research department, or like the University of Washington where there's partners of children? Would we look to what kind of partnerships could we form to have researchers help us to establish, put whatever things we need to go into our programming so they can meet starting promising and then supported and eventually well-supported programming. So we need to be thinking about that now, and that's part of why it's important that the tribes be meeting with your states now as they are developing their plan, because they're going to go through the same thing. They need to have the same requirements. It has to be evidence-based. So it might well be that they will do that research and the tribes can benefit from the results of that research. But it does mean being at the table and discussing that now. I'm going to stop for here right now. Any questions right now? Is this okay, or is this is kind of repetitive probably right now as we've moved along? Any questions at this point? I would think probably not. It is 638 on many of them, but I don't think so. But I can research that more. I'm not sure about Indian Health Service. I know that it's we can capture 100% Medicaid money when there's a 638 tribe, and they can go through the Tribal Social Services. That's a Medicaid provider, and the state can claim 100% federal match for that kind of service. But that's, I don't believe IHS providing the mental health service would be matchable. Anything else? All right. So, the federal funding formula. Starting in 15 months, not quite from now, the direct funded tribes will have 50% and no cost allocation for direct funded tribes after starting in federal fiscal year 2027. That's October 1 of 2026. The direct funded tribes will be able to use their own FMAP, Federal Medical Assistance, Medicaid rate, for claiming the Family First Prevention Services. This is huge. You've got tribes in the United States that have become direct funded tribe and maybe didn't have their court order language and did not use the nunc-pro-tunc option very well. And as a result, the tribe might have 40% of their kids that are 4E eligible because those initial court orders did not have either the contrary or more likely did not have the reasonable efforts, initial reasonable efforts finding. And then they're locked out after that 1 year if it didn't have a nunc-pro-tunc. And so it's frozen. And so for those tribes where they can move from their 40% or so percentage of 4E eligibles to up to 83% for the evidence-based services is huge. It is absolutely huge. For tribes that have a tribal state agreement, of course, it's going to be the same 50% now through September 30 of 2026. And we'll see, starting in 2027, whether the feds will allow families' first type prevention expenses that are provided by the tribe in a tribal state agreement can be reimbursed through the state based on the tribe's federal medical assistance percentage. Don't know that yet, but that will be a question. We've got some time, but it'd be good for that to be on the discussion point now. We know that for tribes that are direct funded right now because of the Fostering Connections legislation in 2008, that those tribes can claim maintenance payments at the tribe's FMAP, medical assistance, and tribes that have a tribal state agreement. The state can claim 4E reimbursement for foster care maintenance payments made to children covered by the agreement at the tribe's FMAP, which again is huge because most tribes in the country are at 83%. Not all, but most. So the administrative and training cost related to Families First legislation will also be reimbursed according to this formula. So this becomes really important as we add maybe some research components to it, and we add, we'll have ongoing administrative costs, and we'll be wanting to train our staff on this new evidence-based practice. The federal 4E Child Welfare Policy Manual already allows to claim 4E reimbursement for training for evidence-based practice. And so that's already, it's been there for quite some time. But this will allow it to be done at a minimum then of 50% direct, and then whatever the federal medical assistance percentage is. Of the current tribes that have an approved 4E plan, now this is the tribes that have an approved plan. Not all tribes with an approved 4E plan have implemented their 4E program. Here I'm just talking about those that have an approved plan, all but one, and there's 10 or 11. You see them listed on there, and this will all be on the website for the conference, so you'll have all this detail in the next day or so. And then there's only one tribe that has an approved plan that's less than 83, and that's the Kennesaw Bay Indian Community in Michigan at 75%. So just to give you a sense of that, it is, and this comes out every year or two, and it's on the Children's Bureau website, and the most frequent one I could find was ends this coming end of September. So this is through federal fiscal year 18, and I'm just projecting, doesn't mean it's going to look like this in 2026, but you get a sense of what it might mean as tribes are planning, and states, tribes in particular, are planning more long term. Yeah. No, no. You'll be at 50 until October 1 of 26. Mm-hmm. Yeah. But, I mean, that sounds like a long ways away, but, you know, in this business, we wind up having to kind of plan quite a bit in advance, so we're ready for things. Okay. Any other questions on that? I did put down for those states that are here at the conference on the pre-registration. And so it may not be an all-inclusive list. There may be some state representatives. So these are both tribal and states that had signed up to attend the conference. Because I thought you might be interested, if you don't already have this information. This is what your federal fiscal year 19, that would start this coming October. So this is October 1 of 2018 through September 30, 2019, what your federal match is for Medicaid. And this is then your federal match for 4E eligible children. Right now, in a few months, what it'll be. And you'll see that the percentage of federal reimbursement for 4E eligible kids, foster care, adoption, guardianship, is based primarily on the state's per capita income. So for tribes, when that was set up, it is based primarily on the tribe's per capita income. And the amount then for Alaska is 50%, but most of the tribes in Alaska would be at 83%. So you look at Arizona, the state, 69.81%, but I think all the tribes in Arizona are at 83%. So just to give a sense of that, yes? When your plan comes through for the maintenance approval, then you will be able to move for 4E eligible children. The maintenance payment will go to whatever your FMAP is at the tribe, not the state. Yeah, it likely would be, because like I say, other than a few tribes that have like a casino or tribal businesses and very few members, then it tends to be, those are the tribes that tend to be less than the 83%. So the Shakopee tribe in Minnesota, a lot of money coming in from the casino and the racetrack, and not very many members. And so that's, but it does vary around the country. And it's to be listed in the, if it's not on the list of the Children's Bureau, the tribe would just ask that they get them that, whatever that appropriate federal medical assistance percentage is. Okay? So primarily, it's based on the per capita income. It is federal range is no less than 50% and no more than 83% by federal law. And that's what states have had forever. There is one state that has had the highest federal match for over 30 years in a row, and that's Mississippi. And theirs right now today would be about 77%. So any of the maintenance payments for 4 eligible kids, the federal government will pay, in that example, 77% of the cost, whether it's to family home or to a residential facility. It's a maintenance, the maintenance payment. That's all I'm talking about here, is just the maintenance payment. But you see the variation. You see North Dakota now is at 50%, and it has been for 3 or 4 years, and it is primarily based on the oil tax revenue in the state. But back when I was the director of Children's Service in North Dakota, it typically ran in the mid-60s. But because there's a big change in the per capita income, then the state has to come up with more general funds to provide the same services. Okay, any questions about any of this? All right. Some other key provisions. The delaying the delinking eligibility from AFDC until July 1, 2024 for children under age 2 at the time the adoption agreement is signed. And you may remember from the legislation on fostering connections, there was the applicable child, in that over time it would make every child who entered adoption from the public system would be automatically eligible under the applicable child if they were not eligible under the regular special needs AFDC relatedness eligibility test. And so on October 1, 2017 is when that ended to be any child starting October 1 of 17 would have been automatically eligible. And that was effective for 3 months. From October 1 of 17, this is finalizing the adoption, when that agreement is final, when the adoption is finalized, and ended on December 31 because the Fostering Connections legislation put in this provision effective January 1 of 2018. So a few states might have benefited for 3 months there. Yeah. Yeah, that's, yes, that, yeah. That's, because that's what the law said, yeah. I think most did, but I believe in examination of when the effective date is that's listed in the law on that piece, because some things, you know, it varies on the effective date on different things. And I think it would be, yeah, it would be effective going back. Now it's, of course, it's in place, and so we have quite a long delay. But by and large, kids, not all, but many kids coming through the foster care system are, by the time the adoption is finalized, is probably pretty close to 2 years of age. Not that that's a goal. Don, are you verifying that? Or do you know, was that, did you think do you have a sense of it? The evidence-based kinship navigator program, effective October 1 of 18. I think I had a note I wanted to mention to you on that. For direct funded tribes, no, I'm thinking of something different. So we talked earlier today about the evidence-based navigator program, that there maybe wasn't some real good evidence-based documentation on it. And I'm going to defer to my colleague Don if he's got more information on this. But my belief is the best documentation and what went into the formation on the Kinship Navigator program and some of that getting in the legislation and other legislation that is not yet passed was the experience in New York City on having a navigator program. So I would refer you to that. It would just probably get it off of Google on their Kinship Navigator program. Because I think, but this will be effective. In other words, it's not, don't have to wait till 2019. It's effective in 3 months. supporting and retaining foster family homes for children. Yeah. Yep, let me bring this over to you.
I mean, one of the things on the Kinship Navigator programs, and we had the handout from earlier of about Section 427 and the activities there, that I'm unclear about, and it may be one of those little wedge issues where there may be a way to get in there. Jerry Milner mentioned earlier that there may not be any or little in terms of evidence-based Kinship Navigator programs now, but some of the activities that are listed in Section 427 of the Act are things like referral to services and all of that that may be administrative rather than service provision. And so one of the questions I have is, would there be any rationale for saying, what about administration of things related to Kinship Navigator? Can that be included somewhere? I just don't know.
I think that's a good question. I think because you think about, well, what is it? Well, most of it is administrative. It's staff. Yeah, yeah. So and that's at the 50%. So yes. Just a second, I'm going to bring this over to you. I want to be able to keep my job here. So.
No, and I think that's right, because the comments that are due in July 22nd, one of the pieces is that for the criteria for the overall prevention services is that access or referrals to services, should that count as a criteria? And certainly for Kinship Navigator programs, that is the foundation of what those programs are. So you would hope they wouldn't be penalized if that's considered not a criteria for prevention. The other thing I wanted to mention too is that Generations United, who I think are actually hosting the workshop next door, they're hosting a webinar on July 16th for states on the Kinship Navigator program. I think they're featuring a program in Florida that is the closest to being well supported. So just in case people want to look into that.
Oh, okay. We'll go backwards. You go first.
Stephanie Sprout with the Children's Defense Fund.
And my friend.
Don Winstead, I'm a consultant to Casey Family Programs.
All right. By this October 1, October 1, the Secretary of HHS shall identify national licensing standards. Yeah, I know, I just skipped it. I'll come back. I'll do it right now. Supporting and retaining foster family homes for children, competitive grants. It's effective February 9 of 18, the day the law was signed. So it became effective that day. And so there are grants now, $8 million a year for 5 years to be awarded. For direct 4E tribes, evidently there's just a one-page form that needs to be completed, and it's due in 2 weeks, July 20th of 18. I would advise any of those tribes that are interested to contact your regional office and see what has to happen if you want to be able to meet. Imagine there's other things that'll come later, but it might not be a one-page form, is my guess. Yes. Well, or states. Now, so tribes that are with a state, tribes that have a 4E agreement, I would recommend there that be part of your planning in your whatever, if you meet 4 times a year or whatever you're looking at jointly on the delivery of child welfare services to state or to a tribe. It could be, it seems to me, that would be a real good consortium kind of thing. You might combine all the tribes, for example, Ina's from North Dakota at Turtle Mountain, and I would think if all the tribes came together, I'm thinking particularly on about half the Native American children placed into foster care in North Dakota do not live on the reservation. They're in urban town, well, maybe not urban, but they're in Fargo and Bismarck and Minot and the other off-reservation communities. So something like this, and maybe in concert with a state agency. I think of Alaska on some of the things there. It might be where because there are the different corporations, but also tribes. Is there some strategy that would enhance it? Because one of the things in the policy from the feds on this is that greater emphasis will be given to jurisdictions that have a large number of children in congregate care. Most tribes do not have a lot of children in congregate care. That's a generalization. It does not mean it's true for your particular tribe. But it does mean, my guess is, out of that 8 million might go unclaimed this year because it didn't start, and I think a lot don't even know that went into a place in last February. So again, 8 million a year, 5 years, competitive grants supporting and retaining foster family homes for children. Okay? Because again, this is consistent with the intent of the Act. Want to get more kids into family homes, fewer into congregate care. This is an incentive to do that. And I think for smaller jurisdictions, in particular, smaller states, that a statewide or a consortium of some kind is more apt to be funded by the federal government than when it's, because some of it is just raw numbers. Some of it is a cost-benefit kind of thing. All right. Now, on October 1 of 18, the Secretary of HHS shall identify national licensing standards for licensing relative family foster homes. We heard from Jerry this morning that it's going to be more broad. It's going to be a guideline. It may not be a specific set of standards, which I think is a good idea, not to have it overly specific. And they are drawing on experiences. Jerry identified mentioned there were 4 agencies. The one that the state agencies for years and years and years used was the Child Welfare League of America standards. And I can't think of a single state that met all those standards. So they're guidelines. But it is what states were using as they established their own licensing standards. And the reason for that is the federal government says that the licensing standards of a state and then of a tribe, including those that have tribes that have their own under a tribal state agreement, the standards must be, quotes, reasonably in accord with standards of national standard setting agencies. That's, and I think what we'll have is something similar to what was in the Fostering Connections legislation. And that allowed states, tribes, to have different licensing standards for relative, as long as all the safety requirements were met in the licensing standard. So you could have, you might mean that you would not have to do everything that was in the standards as long as it wasn't a safety factor. And my own bias is, it isn't going to look too different than that when the secretary winds up issuing this. Because it's still going to be, it's got to be safe. We got to have standards that meet a safety requirement. But again, I don't know what will really happen, but that'd be my guess. And I think we should look seriously at that. I can tell you there are some states that have taken their regular standards, and then they have another set of standards that just deals with safety, and it's only used. It's only used when there's a relative kind of placement. Any questions? I'm going to come over here, Don. The question that was raised is, the Secretary is going to issue these national standards for licensing relative family foster homes, and the question is, after those are established, when do they have to be implemented?
Never, except that by then April, the state has to say back whether or not they are in compliance, and if not, why not, But if the state wanted to say back, we're not in compliance and we think we have darn good reasons, then that's all the law requires is that you say back. So you don't have to ultimately be in compliance, although certainly if you're not, the expectation would be if you don't have a good reason, at some point Congress may come back and want to enforce it. But at least as I read it, it doesn't require compliance. It just requires a report back.
Okay. And it allows Title IV foster care payment for a child placed with a parent in a licensed residential family-based treatment facility with no 4E eligibility test. So that would pay for the child, not the parent, but it would pay for the child's care. Now, right now, under federal policy in the Child Welfare Policy Manual, it is possible for a child to be placed with a parent in a residential facility as long as the state or tribal agency has placement and care authority of the child. So essentially, the state agency, 4E agency, would be placing the child in that facility. Of course, that facility would also have to be licensed as a foster care facility. This is much better. But that's how states got around that in some jurisdictions. State of Maine, for example, had some placements like that several years ago, and it was acceptable because of the federal policy on it. Now, I also believe that a lot of, well, we know, with all these changes, there are going to be changes in the state and tribal 4E plan. There will also likely be a change in the state's public assistance cost allocation plan, that's the PACAP, and for tribes, the cost allocation methodology. Because as you're dealing with new services or formulas and all that and reimbursement claims and how you're going to treat training, for example, and be able to get the same kind of match, then that's going to have to go into a cost allocation plan, or for a tribe, the CAM, cost allocation methodology. I should also say that back to the congregate care, I was going to mention, there will be some limitations on that, but for the administrative costs of serving a child or a child in that facility, it does not affect the administrative cost. It affects the maintenance kinds of costs. And so that could become a factor also. And I'm going to look at my guide here and see if I'm still hired or not. So, all right. Okay, here we go. The direct funded tribes, requirements for directed 4E tribes will be much like a state. We'll need to amend the tribal 4E plan and CAM. There will be instructions from the Children's Bureau when this is due and the requirements. And for tribes with the tribal state 4E agreement, it's essential that the tribe be a part of the planning, kind of what I talked about before, to assure the tribe's interests are addressed, and that they are included in amendments to the state 4E plan. It may well be that in the state 4E plan, there will be certain of the services that are going to be provided through the state agency, and I think it'll be possible that the tribe would be able to provide some different services as long as it's in the state 4E plan amendment dealing with how the state is going to be addressing the preventive in the implementation of this act. Depending on the language in the current tribal state 4E agreement, it will likely be a good idea to update, revise, or amend your current 4E agreement to include these added services and those things that are under the Families First legislation. It might be a broad sweep already that you'd say, it's already in there, but as you are negotiating at the tribal level with the state on the 4E agreement, I would suggest that this at least be addressed so that the tribe's interest is protected in that plan. Yes? I'm coming to you.
So my question would be, we have a couple of tribes that are really small that don't have a 4E agreement right now. And in thinking about this legislation, could I have a agreement just for the prevention part of 4E now?
The question is, there's some smaller tribes where there's not a 4E, current 4E agreement on the regular foster care program, and could a new agreement just address the Families First Prevention Act? And my belief is yes, that I don't see anything in the legislation that would prevent that. The same rules would apply to that tribe that would apply to the state and that kind of a thing. But that's would be my opinion on it. And we are now what you call waiver of time constraints. And so I'm just going to take about 37 seconds and see what we have here. Discuss with the state if the tribe can provide an evidence-based program if the state includes it in the state 4E plan, even if the state does not provide it. It's kind of what I just addressed before that. And then the last thing, and I won't go into the detail on this. These are a variety of the funds that are available to tribes to some degree that could possibly be used as the non-federal match for the implementation of the program. And you'll get some tribes that have do more in the adoption area, the last one here. And, the states have to identify, but so would direct funded tribes, the applicable child benefit, the savings. And so that money is non-federal money, and so it typically can be used for other kinds of services. So, any other questions before we get the signal? Anything at all? Well, thank you very much for your involvement and good questions, and it's time to break. Thank you.